President Cyril Ramaphosa is expected to address the nation on the relaxation of lockdown regulations. This as COVID-19 infections in South Africa decreased, with 5,309 new cases reported in the past 24-hour reporting cycle. For more, we are joined by South African Medical Association chairperson Dr Angelique Coetzee and Progressive Health Forum convener Dr Aslam Dasoo. Good evening to you both, and thank you so much for your time this evening. I'll begin with you, Dr Coetzee. Your expectations tonight as the President is set to address the nation at 8 p.m.
Good evening, and a good evening to all our listeners and viewers out there. Well, I hope we have good news tonight. I think we will be going down to level 2. I think it is, if you look at our numbers is severely decreasing. Our infection rate is also coming down. In the interest of our economy and to ease the pressure of business, and I think we need to start opening up. Hopefully we will have the curfew from 11 o'clock at night till 4 o'clock, and that your restaurants and bars can be open till 10 o'clock at night. And also looking at our gatherings, again, level 2 will mean 100 people outside, more than 100 outside, and hopefully 250 people indoors, and alcohol sales to be open up as well. But all of this, even if we move to level 1, vaccination is actually not even something that we need to negotiate about. Because if we don't get the vaccination right, we're going to go back to level 3, and we will seesaw for the next few years to come between levels and livelihood and our economy that are not where it should be.
And Dr. Dasoo, some people are saying that, should the economy be opened up, the activity be opened up soon enough, it may put a burden on the healthcare system, especially when you look at the fact that we're still dealing with high levels of vaccine hesitancy.
Good evening. Yes, thank you for inviting me. Yes, I think that's correct, and I agree with Dr. Coetzee on what she has said. We still have a lot of circulating virus. Even though we are coming down off this third wave, it has had a long tail. We all expected it to be at this level a lot earlier, but we are where we are right now. And unfortunately, the positivity rate is still well over 10%, and you only declare a wave over when you come to 5% or below. However, the issue around opening up activities, and we expect the President will go to, or will put us on a level 2 footing, perhaps even a level 1. And I only say this because I don't think there's going to be much of a difference right now that these different restriction levels will make. What will make the difference, of course, is vaccination. And I think at this point, our vaccination levels are still very low. You've mentioned vaccine hesitancy, which is still quite high. But I think a far more concerted effort is now required. And I see that people are trying innovative ways of reaching more people, getting vaccine to communities rather than expecting people to come in. And one hopes that those efforts are now accelerated.
And Dr. Coetzee, when we look at the current numbers, we're seeing that from maybe like mid-July, we have also seen a shift. This is in the age distribution of cases. Would you say that this poses some kind of dangers? Should we go to level 2?
I don't really think it's going to pose that huge a danger, because if you can get those age groups, especially 18 years and plus, if we can get them vaccinated, and if we can get more people above the age of 50 to be vaccinated, it would not pose that huge a danger. But again, the fact whether people are going to get vaccinated, and we are behind, Dr. Dasoo is absolutely correct. We are behind with that. We do expect another 4th wave to hit us sometime around December. We might be wrong. It might be later. I don't think it will be earlier. But if we can get the vaccination process going, then our hospitals would be able to handle the burden as well as the doctors. Because in the end of the day, we keep on saying that the lockdowns are because we cannot, the healthcare system is under pressure. So to elevate and get the pressure off our healthcare system, we have to vaccinate. And people doesn't really get that. And I think they are tired of hearing they have to vaccinate. And as Dr. Dasoo correctly said, if we can have the vaccination centers at the entrance of Woolworths, the entrance of Pick and Pay or Checkers, I think that would help a lot to get these people vaccinated, because then sometimes it's not that they don't want to get the vaccination, it's just not part of their thinking process. And if you have to walk through a place that you can be vaccinated to get your groceries, I think you will then do your vaccination. I think it would be easier.
Dr. Dasoo, we're heading for an election. There's real concerns, especially when, in light of what you spoke about, the levels or the numbers of people that have vaccinated are still nowhere near what officials are expecting. Could we reverse some of the gains that have been made should we find ourselves going to an election with still this small of a number of people who have been vaccinated?
Certainly. I think the risks are very high. And you mentioned the election. This is going to be the major activity now for the rest of the year until the election. And as we know, elections will cause a greater mobility of people. Now, we did put forward to the Moseneke Commission our view that because vaccination levels are so low right now, and because there is a statistical certainty of a certain number of deaths, that by February next year, when he had suggested we move the election to, there will be many more people vaccinated with a correspondingly lower number of deaths. Now, this is an ethical issue for us. Obviously, the political establishment felt differently, and we are where we are right now with the elections going ahead. So, two things are very important right now. It's up to political parties to do everything they can to minimize transmission when they are out at the hustings. They have to do this. Trying to hold big rallies and so on is just going to make the transmission increase dramatically, bring that fourth wave closer. So that's the first thing they have to do, and they should make a commitment to it, and people should watch them. The second thing they should do now is to turn this situation to our advantage. Every political party should make a pledge to encourage vaccination of all of their members, their supporters, whoever they can reach. And again, we have to hold them to account on this, because if they fail to do this, they are failing the people. And they will then need to be punished at the polls. This is how important this is. So we will make a very strong call to them. You now have the election when you wanted it, with all the dangers and the risks that it poses, so act responsibly. Totally make sure that your activities comport with the fact that we are still in a pandemic emergency. And second, make sure that you call on people to vaccinate. Make it part of your campaigns, because that's how you will demonstrate you actually care for the people rather than for your political ambition.
Dr. Coetzee, could the introduction of a vaccine passport assist the country to achieve herd immunity?
Well, at this stage, we're not looking at herd immunity. We are looking to get as much jabs in arms than we possibly can. We are looking to bring down severe cases. Herd immunity will be on the cards later on. As Dr. Aslam Dasoo correctly said, if we don't, when we're now going into elections, if we don't hold our politici accountable, they don't take responsibility for their actions, how can we trust them then to lead this country going forward if they can't even get it right to get people to vaccinate if they want to vote or if they have these gatherings. The vaccine passports is important going forward, especially around if you want to have or attend big meetings, sport meetings, other gatherings out there. The passport is important if you want to travel outside of the country. It's not only South Africa that wants a passport, it's the other countries as well. So it's not unique to South Africa. We have to make sure that our people understand that the vaccines open up doors for them to travel, as I have already said. There will be some of the employers going forward that will insist on their employees to be vaccinated and produce a vaccine passport. And correctly, we're still in a pandemic. And in a pandemic, the health of the nation plays a much bigger role than the health of the individual or the views of an individual that says, I do not want to be vaccinated because I do not believe in it. If you don't believe, it's fine. You have your beliefs, but there will be consequences going forward. And as quick, the quicker you get your vaccine passport, the quicker the doors will open up for you. And as I have said, it's not unique to South Africa. It is what is happening in the rest of the world.
Dr. Dasoo, as a final question then, we saw SAPRA approving the vaccine for 12-year-olds. Will this help at all?
Yes, I think it will. I think the information that has come from abroad, the data has shown, and we know that some countries have already started vaccinating 12 years and above. And I think it's just an attempt to make sure that as many people as possible are protected, and that with vaccination, far more activity can occur that will create normalcy in society. Also, of course, we know that vaccination also reduces transmission in that people may still get infected, but they eliminate the virus much more quickly. So there's nothing wrong with doing that. I think that the data is in and it's shown to be safe and effective. I know South Africa has approved the Pfizer shot for over 12s, and there is a trial about to begin with the Sinovac vaccine also for that age group. And I think that's all part of the course. Right now, the most important high-risk group are the over 50s and those with comorbidities, and we should do everything we can to get as close to 100% of that cohort vaccinated, because over 60s make up more than half of all admissions to hospitals. So if you want to take pressure off your health system, you need to vaccinate those people at speed as well. But very, very important. Right now, we have to be clear that with the reduction, as we expected, of the restriction levels and with the increased activity of elections, we are in a high-risk situation. A fourth wave is definitely on the cards. The only question is whether our behavior can hold it off for as long as possible. And that's up to the political parties. So they must come out clearly now to the people of the country and show clearly how responsible they can be as far as this is concerned.
Sobering thoughts there tonight. Thank you so much to you both for your time. That was Dr. Aslam Dasoo from the Progressive Health Forum and Dr. Angelique Coetzee from the South African Medical Association.